Is your tirzepatide looking pink? Stop. Do not inject it. Here's what you need to know. Tirzepatide, sold as Mounjaro for type 2 diabetes and Zepbound for chronic weight management, is a dual GIP and GLP-1 receptor agonist. And when it comes to how it should look, the standard is pretty simple, clear, or at most a very pale yellow. That's it. Any pink color is a red flag that something is wrong with that medication, so why might it turn pink? There are a few possible reasons. One is blood contamination. If blood has somehow entered the auto-injector, it can give the solution a pink or reddish tint. Another cause is chemical degradation. Tirzepatide is a complex synthetic peptide, which means it can break down under the wrong conditions, like exposure to heat, light, or freezing temperatures. And in some cases, pink discoloration can point to a manufacturing defect. None of these scenarios are acceptable for a medication you're about to inject into your body. It's worth knowing exactly what normal looks like. The solution should be completely clear, free of particles, free of cloudiness, and either colorless or very slightly yellow. If what you're looking at doesn't match that description, especially if it looks pink, red, brown, or cloudy, don't use it. Storage plays a big role in keeping your medication safe. Tirzepatide needs to be kept refrigerated, protected from both light and freezing. A good tip, keep it in the original carton to help shield it from light. If it's been stored incorrectly at any point, whether in transit, at the pharmacy, or at home, that can affect the integrity of the solution. It's also important to remember that these are single-use auto-injectors. Discard them after one use, regardless of whether medication appears to remain in the device. Now, what should you actually do if something looks off? Don't inject it. Contact your pharmacist right away. They can advise you on whether the medication needs to be replaced and help you figure out next steps. If you've already injected a dose that looked unusual and you're experiencing any unexpected symptoms, reach out to your doctor or healthcare professional as soon as possible. This is also a great conversation to have with your prescribing doctor ahead of time. Ask them what to look for during your visual check before each dose and what your options are if something looks abnormal. Knowing that process in advance means you're not scrambling in the moment. Quick recap, tirzepatide should always look clear to very pale yellow. Pink is not normal. Pink discoloration can mean contamination, degradation, or a manufacturing issue, and the medication should not be used. Store it properly in the refrigerator in the original carton, away from light and freezing, and always do a visual check before injecting. And as always, nothing in this video is a substitute for personal medical advice. Talk to your doctor or healthcare professional about any concerns specific to your situation or your medication. Have a question about what your medication should look like? Drop it in the comments. I'd love to help. And if this video was useful, give it a like and subscribe so you don't miss what's coming next.